Module 3, Lecture 2, Inherited Breast Cancers. Breast cancer, as I stated in the previous lecture, is very common. Females have approximately a 12 to 13% lifetime risk of developing breast cancer. Males have a 0.1% risk of developing breast cancer in their lifetime. Most breast cancers are not hereditary. So most of the women, the 12 to 13% that develop breast cancer in their life, do not have a predisposing gene. Approximately 3 to 5% of all breast cancers are due to mutation of the BRCA1 or BRCA2 genes. We started naming genes better for what they do, so BRCA1 is the first breast cancer gene that we found, and BRCA2 is the second. More and more genes are being linked to hereditary breast cancers as well as other cancers. So, hereditary breast and ovarian cancer. The BRCA1 and BRCA2 genes are tumor suppressor genes. Presence of this gene is inherited in an autosomal dominant fashion. So, if someone carries a mutation of a BRCA1 or BRCA2 gene, the chance of developing breast cancer in their lifetime is 84%, as opposed to 12 to 13%. Developing a second breast cancer, 64%, as opposed to 11%. Males with breast cancer, less than 1% of males in the general population will develop breast cancer. However, 6 to 8% if they have a BRCA1 or 2 mutation. Ovarian cancer, 44% of patients with a BRCA1 or 2 mutation will develop ovarian cancer, whereas it's about 1.5% in the general population. And pancreatic cancer, 7 to 8% of individuals with pancreatic cancer have a BRCA1 or 2 mutation, as opposed to 1% in the general population. Hereditary breast and ovarian cancer and management. This is actually a Time magazine on the Angelina effect. For many years, people were afraid of having genetic testing because they're like, well, why would I want to know if I'm going to get cancer? Why would I have this testing? And the reason is we can actually change the outcome if we know in advance. So, for instance, if a woman carries a BRCA1 or 2 mutation and they have bilateral mastectomy, this can decrease the risk of developing breast cancer, not to 0, but to a much lower, level. Even with no surgery, increased breast surveillance beginning at age 25, including breast MRI, has been shown to at least find the cancer at much earlier stages. In addition, risk-reducing bilateral salpingo oophorectomy after childbearing has also been shown to decrease the risk. If you take out the ovaries, you decrease the risk of ovarian cancer now from about 10 to 15% to less than 1%, and taking out the ovaries in and of itself will decrease the risk of breast cancer. So, other things. Oral contraception in BRCA1 and 2 positive women, decreases to the risk by 53%. Tamoxifen can decrease the risk of developing breast cancer by 49%, again from 85% to in the 40s. Mastectomy decreases from 85% by 90%, so you're less than 10%. Oophorectomy. The risk of ovarian cancer decreases by 90%, and the risk of breast cancer decreases by 68%. So taking out the ovaries, it has to do with the hormones, can decrease your risk of breast cancer. So here we have a pedigree, a family history of a breast and ovarian family. And when we talk about pedigrees, when we're talking about taking a family history, it's, I would be less concerned if there was a breast cancer over here and maybe a breast cancer over here, then I'm seeing the cancer all on one side of the family. So this individual had breast cancer at age 45, and this is, of course, our patient that we're interested. She has that arrow. Her mother died at 65 of ovarian cancer. Her mother's father died at 55 of prostate cancer. And again, prostate cancer is one of the most common causes of cancer. But when you look at their family history, she had a brother that had 2 daughters who both had breast cancer at young ages, one at 54 and one at 35. And this is a very concerning family because all the cancers on her mother's side They're different kinds of cancer, but related. Ovarian, breast, prostate. Here is another family history. And what would concern us, here we have breast at age 40, but the father had a mother's mother had ovarian at age 50. So even though there doesn't seem to be a ton, you see the father's mother, a ton of cancer through paternal lines. Men don't have breast, well, they have some, increased risk of breast cancer, but it's so much lower. They don't have ovaries, so they can pass on these genes but not be affected. Another inherited cancer gene is Fraumeni, and it's caused by a very important tumor suppressor gene, TP53. And this gene, when this is not functioning correctly, can result in a variety of cancers. The risk of breast cancer in patients with Fraumeni is 80% versus, again, 12% in the general population. Brain, 22%. Sarcoma, 20%. Colorectal cancer or CRC, 14%. Pancreatic, 11%. Bone cancer, leukemia. So there are a variety of different cancers that can be seen with Fraumeni. The family history of Fraumeni is particularly concerning. So here we have a 40-year-old woman, and her dad died at 25 of osteosarcoma. So you see this word sarcoma. When you see the word sarcoma, think P53. And he had a sister that died of leukemia at 10, and a brother that died of colorectal cancer at 45, and the mother died, developed breast cancer at 39 and died at 40. On the maternal side, there was a uncle who died of lung cancer at 65, but he was a smoker. So again, this is important, but less likely. Most of the cancer is all on this side of the family. And this is Fraumeni kind of family history. More breast cancer genes, CDH1. This can also be associated not just with breast cancer, but also hereditary gastric cancer. PTEN, it can also be called Cowden syndrome. There's an increased risk of breast, follicular thyroid, and it's important, follicular, colorectal cancer, kidney cancer, and endometrial cancer. Patients can have specific facial features such as a large head, goiters, polyps, learning problems, and mucocutaneous skin lesions. STK11 is associated with something known as Peutz-Jeghers, and there's an increased risk of breast and colon cancer, and there can be hyperpigmented, like freckling on the lips, eyes, and genitalia. So here we have CDH1 inherited diffuse gastric cancer. Gastric cancer can occur at any time. However, it's most likely to occur between ages 20 and 40. 20 to 40% of patients with this mutation will develop gastric cancer. And the CDH1 gene codes for something called E-cadherin. The E-cadherin impairs adhesion, increasing the likelihood that cancer cells will not come together to form a tumor, but will invade the stomach and metastasize. There's also an increased risk for both lobular breast cancer and lobular breast cancer. The PTEN Cowden is characterized by non-cancerous keratomatous growths, and here are some of the growths in the mouth. They can also be seen in the hands. In Cowden syndrome, the patient is at risk of developing many different kinds of cancers: breast, thyroid, colon, and uterine. Cancers usually occur between ages 30 and 50, and the mutation of the PTEN is located on chromosome 10. So, this is some of the facial features. This trichomelia, again, breast cancer, endometrial cancer, thyroid cancer. Minor criteria include intestinal polyps, fibrocystic breast disease, and lipomas. Here are the freckling on the lips seen in the Peutz-Jeghers with STK11. This codes for it's inherited in autosomal dominant fashion. There's an increased risk of other tumors with Peutz-Jeghers, including breast cancer, about 32 to 50%, colon cancer, 39%, especially keratomatous polyps. So here's a picture of the polyps. stomach cancer, and ovarian cancer. So, a woman is diagnosed with breast cancer at age 22. The family history indicates her mother died from breast cancer at 30. She has a brother who was diagnosed with osteosarcoma at age 15. A maternal uncle died from neuroblastoma at 10. Which gene should be tested for? A. BRCA1, B. STK11, C. PTEN, D. TP53, or E. CDH1. And this concludes Module 3, Lecture 2 on in cancer inheritance.